record this. So good morning, everybody, and thanks for joining us for this July 2021 office hours. I'm Chris Krasnowski, the Communications Director at the Wisconsin Institute for Healthy Aging. And I have several of my colleagues here with me as well today, and you'll be hearing from most of them as we go through the next hour. So first, as is traditional, let's do a quick icebreaker just to get everybody warmed up. What is the best thing you've done or plan to do this summer? And I'll ask you to throw your answers to that in the chat. So think a second, or maybe you know right away. What is the best thing you've done or plan to do this summer? Whoa, Angie Sullivan, hiked 15 miles at Devil's Lake with your 18-year-old. Awesome. I know that's grueling. So I don't know if I would think of that as fun necessarily, but that's a pretty great accomplishment. Tammy Queen's been to Door County. Oh, love Door County, Tammy. Immersive Van Gogh exhibit. That sounds so cool. Kayak trip around the Apostle Islands. I heard about this from Erin. I don't know how she did that without her arms falling off completely. Camping. Yes, campers everywhere, I noticed. Oh, Linda's youngest daughter's engagement dinner. How lovely. Laura Armstrong got to vacation with her family. Jill's been watching her boys play some baseball, America's pastime, and the Brewers are doing so great this year, so it makes it extra fun. Leslie's been to 5 different weddings, probably 2 from last year and 3 from this year, kind of thing. Boating in Door County. Chris has had a staycation. Jennifer's been to Arizona and saw the Grand Canyon. Isn't that awesome? One brewer game from Heidi and I. Oh, one brewer game per month from Heidi. Awesome. That sounds great. Touring 4 colleges in 3 days from Lisa with her daughter going off to school. Olivia spent the week up north. Hunstrup. Hunstrup created some yard art, glass totems. Wow. Well, our Karen Beck would love to talk to you about that because she's a glass artist as well. Jennifer Clark has been camping and heading to the cottage. Jennifer LePever has been camping. A lot of campers, hiking in county parks. So people have been, it sounds like a lot of outdoor kind of things that have been keeping everybody busy. And, as we're kind of coming to the close, hopefully, fingers crossed, of the pandemic, I think people seem to be making outdoor activities and exercise and doing things more of a habit, which is maybe a great outcome, a positive thing that might have come from this. So thanks for everybody for sharing. And so we're going to get started. I'm going to introduce first our own Jill Rankin from the Wisconsin Institute for Healthy Aging and Angie Sullivan from the Greater Wisconsin Agency on Aging Resources. And we're going to talk a little bit this morning about program planning and partnership development. And we want this to be a conversation. We want a group discussion to get started here around what are we going to be doing. Some organizations may be getting additional resources as a result of the pandemic. What are your plans for some of those additional resources if you'll be getting some of those? How can we determine, how do we develop partnerships potentially to help us either expend those resources or create new opportunities within our communities for healthy aging programming? So with that, I'll turn it over to Jill.
Great. Thank you, Chris, and good morning, everybody. So like Chris said, we want to take this opportunity. As you know, we are here to support you. We here at WIHA are to support your efforts and all the wonderful health education things you're doing in your community. And we really want to start that off by providing a space for you all to learn from each other. And summertime is a great time to kind of take a step back and plan for, obviously planning for the fall, but also for the next year. And we are doing that here at WIHA as well. As far as planning, we'll have some updates as far as our planning goes for leader trainings next year and so on and so forth. But just taking this kind of relaxing time in the summer just to plan for things going forward. And a lot of that may involve could potentially involve some additional federal dollars that we know, for example, aging units will be receiving some additional Older Americans Act Title III-D funds over the next 2 years. And some of you and other organizations may be receiving some additional federal dollars also. So, or other sources. So we just want to take this opportunity to just kind of talk a little bit about logistics of the funding. Angie is going to talk to you a little bit about that. And then figure out how we can all work together to be able to utilize those funds as best we can. So whether you're an aging office or not, these additional funds, and even without the funds, looking at how can we maximize our resources to have the greatest impact through our healthy aging efforts is really going to be the focus of today. So I am going to turn it over to Angie here for a little bit to talk about logistics of the kind of an overview of the Older Americans Act Title III-D funding that's going to have some increases here over the next couple of years. And then what we'd like to do is we have a couple of you on the line today that are going to talk a little bit about what your plans involve or your initial thoughts as far as how to leverage these resources. And then open it up for discussion for all of you to talk a little bit about your thoughts on that, maybe some questions, some overall strategies. And then I'll take a step back and kind of reflect. We've seen some, just from talking to you all, we've seen some themes as we're having these discussions come out as far as like there's about 3 focus areas that we're seeing so far. So we'll spend some time on that as well. So without further ado, I will hand it over to Angie, and you can talk a little bit about the logistics of this first.
Great, thank you, Jill. So a lot of you on the call are aging units and ADRCs, and Older American Act funding will be getting some additional funds over the course of the next 2 years. I'm by no means an American Rescue Plan expert, but I'm going to tell you what I know, and I think if I've learned anything over the last year, things are subject to change, but this is the most recent information that I have received. This additional funding comes at a fairly good time since all the aging units are working on their 3-year plans. So getting these additional dollars, you will be able to hopefully do more and kind of take from your wish list and start doing some additional infrastructure building, those types of things. So I'll just kind of tell you what I know. So on March 11th, the American Rescue Plan was signed into law by President Biden. So that gives an additional $1.434 billion for Older Americans Act across the country. So what does that mean for Wisconsin and in particular Title III-D? That's an additional, it's about 1.7 times the usual allocation that Wisconsin receives for 3D funding. There will be a service match of 10% required for those funds, which can be in kind, obviously. So some things to think about there. In addition, I know a lot of our aging units and ADRCs will also look to other funding since those funds will need to follow the provisions and priorities as all evidence or all 3D programs. So it has to be high level evidence based. So those guidelines are still in effect for those dollars. However, in the Title III-B, which is supportive services dollars, there is a item which specifically calls out social isolation and loneliness for detection and intervention. And I will put the link in the chat where you can read more specifically about the information that I'm giving you. So you can be potentially using different pots of money in the different sections. Additionally, they will be receiving aging units and ADRCs caregiver dollars as well. So I know some of the evidence-based programming, you can utilize the caregiving dollars. So there will be quite a bit extra or additional funds coming in. Those funds, I spoke with Cindy Alfstead from the Bureau of Aging and Disability yesterday at the state level, and those funds they're hoping to be out by the end of August, if not sooner. So expecting those funds to come in. And I will put the link so you can learn more, but that's just really a high level overview of those funds coming in. And I know not everyone on the call is an aging unit or ADRC. However, it is allowable within the Older Americans Act if the aging unit does not have the resources to really, and keep in mind, this is a short term, 2 years, this additional money. It's not going to be sustainable. So this is a great time to build, but keeping in your mind too that this is something you'll need to be able to sustain without these additional funds in the future. So to keep that in mind. So for those that are not in an aging unit or ADRC, it's a really great time to reach out to your local aging unit or ADRC to partner on programming. These funds do need to go to the local aging unit. That is how the money will flow. So that local aging unit cannot be spent by the state. It's not going to be held up at the state. It does need to go to the individual aging unit. And then the decision is made at the local level on how those funds are going to be spent. So that was a lot of information, and I will put the link in the chat for everyone so you can kind of see what ACL has a really nice PDF that has all this information on it. So does anyone have any questions? Keeping in mind, I'm not the expert. I may be referring you to those if it's real specific to our fiscal department at GWAR. You will also need to report the data into SAMS, similar to how, with the typical 3D dollars.
Thanks, Angie. Yeah, so any logistical questions before we start talking a little bit about how folks might be thinking about spending these additional funds?
When do they have to be used by? In 2 years?
Yes, so and Cindy Alstead will be on our health promotion webinar in August to give real updated information with that. I will have to check with our fiscal department. I believe it was September of 2024. You will have 2 years for the use of those funds.
Okay, maybe I'll just have to talk with you separately since we are merging with our ADRC in our county as of January 1st. So.
Yeah, but that won't affect your aging unit dollars coming in. So
it will not.
Nope.
Okay.
Any other logistical questions for Angie? Okay. Feel free to ask as we go along, but like I said, we wanted to provide some space for you all to kind of brainstorm together and figure out, different directions, different opportunities. I know I talked with a few of our program providers who would love to have ideas. So I know Angie, hopefully it's okay if I speak this for you, but I know we're going to be working on collaborating together and working on kind of like an ideas sheet. So that we can collect ideas from all of you and distribute that to everyone as we go forward and as we're working through this. So I'm going to, I know Barb is on the line from Brown County. She's got some thoughts as far as what they're going to be doing. I also had the opportunity to speak with Erin Wells at the ADRC in Central Wisconsin. She is not able to join us this morning, but she did say I could report out for her. And one thing that Erin is going to be doing, what they're thinking about up there is partnering, and actually I think Jennifer, you're online too. Okay, Jennifer Clark's here too, so feel free to chime in, Jennifer, if I get anything wrong or you want to add to this. But thinking about leveraging partnerships, and I know Angie mentioned that as well, is these funds don't necessarily have to stop at that aging unit level where they're going to be working with their local partners, different organizations to maybe add on additional programs that may meet some needs and gap areas where they may not have the capacity themselves to add on additional programming, or maybe even handing off some of the current programming that they're currently doing onto new and existing partners. So I don't know, Jennifer, if you want to add anything to that, but things like working with the Hmong population, I know up in the Central Wisconsin area is one thing that Erin mentioned as a goal. and they're seeing as a need. So maybe getting some programming around that area and then partnering with organizations that are able to deliver that. So they're not necessarily delivering the program themselves. So the expansion being not taking on more programming that we don't have capacity for, but spreading it out within additional partners and allowing some of those funds to go to other partners and contracts and things like that. So.
And Jill,
Thank you, Jill.
Sorry, this is Vicky. I was just going to add too, if you're doing, you don't have that capacity and you want to reach out to partners, and even if you do have capacity, it's a great way to continue to spread your programming is just to create a memorandum of understanding through the aging unit that clearly outlines the expectations, who's collecting the data and reporting that, just really simple, and I can provide samples of that if anyone's interested. But that's been, we have aging units partnering with hospitals, clinics, YMCAs, recreation centers, the list goes on. So sky's the limit.
Thanks, Jennifer. Anything you want to add to that? Jennifer
No,
Park?
I was just going to say that I think you hit it all. So yeah, that's kind of our plan moving forward. And we're really kind of excited about that. So.
Awesome. Great. Thank you so much. Barb, you want to share what your thoughts are, what you guys are going to do?
Sure. Just to double check, can you hear me okay?
Yep.
Okay, good. Yeah, our focus with applying for the extra 3D funding was really focused around the Healthy Living with Diabetes workshop and seeing how we could boost participation with that. So I didn't reach out to new organizations. It was more those that we had some type of a relationship with already. So it was focused on our 3 health systems, a local private pharmacy, and then one of the insurance companies. And with the health systems, it was really specific to those 3 individuals that oversee the nutrition services department. So oversee the RDs, the CDEs, nutritionists, that kind of thing. Of those who I reached out to, there were 3 of those that were interested. 2 of them had challenges just with the timing of getting through compliance, what they could and could not do. So I think that's a learning for us going forward is how do we continue to continue those conversations and what that means for them and for us as we partner on some of that. And then one of them agreed to move forward with doing a mailing and targeting specific individuals that they felt could benefit from the workshop. So since the approval of the funding from GWAR, we've set some dates. So we'll do a mailing late August and then also wrap that around with print advertising and then Facebook posts. So hopefully, come more like September-ish, we'll have some learnings to share back with, how that worked, what was successful, what was not successful.
Awesome. Thank you, Barb. So focusing on participant recruitment and awareness building through marketing and some direct mailing, it sounds like you said. Yeah. Yeah,
and just to add, I forgot to mention in terms of the targeting, I think the targeting approach that they're doing is very, very good in that it gets down to almost the block level to build in those social determinants of health using the ADI index, which is the acronym for Area Deprivation Index. So it's something new that they're using too. And it was something new to me that I had to kind of have them explain what it is and how they're using it. But it's, if you Google ADI index, there's a lot of articles on it to read more about what that is. But I think it will help all of us get more at, those targeted areas for health disparities and addressing those social determinants of health.
Great. Yeah, some overall solid strategies. And we've seen that too in our past work with other partners throughout the state, that targeted marketing and that targeted approach really works, especially within the healthy living with diabetes. So obviously there's a lot of other factors that go into that, but yeah, we'll be excited to hear.
There's a question from Michelle, wondering if Barb's marketing and partnering with organizations to promote a specific workshop or just getting information out related to diabetes in general.
This is very specific to the workshop, Healthy Living with Diabetes. And only because I was thinking that it had to be very specifically targeted to evidence-based programs. So I know maybe Angie, you could also comment on that.
Yeah, with $3D, if you're utilizing those, it has to be towards an evidence-based program that's considered eligible for 3D funding. So yes, that would promotional materials that are targeted specifically for that would count. But if you were just sending information out about diabetes, then you would not be able to use $3D.
I can see that if you had additional funding, though, how that would be a great merging of, increasing awareness on diabetes and then following up using the $3D for Healthy Living with Diabetes workshop in specific. So I think both are great.
And another item that I want to mention, prior to COVID with $3D, you could not use that towards technology. However, that is a change since COVID that you can use $3D for technology. It really is anything that is needed to implement an evidence-based programming. And if you're doing it remotely, you chances are you may need to develop a loan library of tablets or hotspots. So that is something that can be purchased with $3D. And with this one-time funding source, that may be a good avenue to build up your ability to do remote programming. ACL has other considerations to build capacity through maybe mailing toolkits. And I know WIHA has talked about their different toolkits available. So just thinking remotely, heaven forbid this ever continues on, but I think even the lessons that we learned during COVID with remote can be done over the winter when we typically don't see a lot of programming.
There's a message from Kate in the chat. She'd like to do this in her county, but needs to highlight for partners how they benefit from helping them. Obviously, a healthier community, but are there other specific motivators for these folks that you've found? So in terms of how have you motivated partners to want to work together with you around promoting, access to or additional evidence-based programs in the community?
Yeah, Chris, I could speak to that a little bit. Prior to my position at GWAR, I worked at a hospital, and through our community health needs assessment, we identified priority areas similar to what the aging unit plans are going through right now, identifying goals. One of our goals was fall prevention. So I reached out to our local, at the time, it was Rock County Council on Aging, to see what they had available that we could partner on. So looking at your local hospital, and Laura Armstrong can probably talk to this a little bit too, about their community health needs assessment, which by law has to be displayed on very easily to be found on their website, to see if any of your goals match up with some of their goals, and also look at what community engagement you're coming in. So the motivation there on our side from a hospital's perspective is that we were working towards our goal of reducing fall prevention in the community. So we had a facilitator, myself, trained in stepping on. So we started doing programming there and expanded that into Strong Bodies. So we not only completed our goal, but also created a partnership for future programming with our local county aging unit. So that's just a kind of aside from a hospital on, where we were coming from and what our motivation was to partner.
Thank you, Angie. Barb, did you want to add anything to that as far as what you've heard from your partners?
Yeah, I think the driver is always, who is not among their patients, meeting their respective quality measures, whatever that is. So for the insurance company, it's the HEDIS measures. For the pharmacy, I don't recall exactly what the name of it is, but everybody seems to be striving to meet those quality measures to retain their own high rankings. So that is definitely a plus in trying for them to partner if there's funding that we can collaborate on together.
And I know specific to health plans too, it's the actual health outcomes that are the motivator, obviously, for that part of it. Great. Other questions, or anybody have any other thoughts, ideas, thinking about, over the past couple years, hey, if we had more funds, what would we want to do? What could we do? Like kind of dreaming, one-time spending. Anybody have any thoughts on that initially right now you want to share?
Jill, I could add one more thing that I forgot to mention is with this conversation of applying for the extra funding, one of the things that I learned about was the inexpensiveness of a boost in Facebook posts, which was about $5 a boost, but each boost reaches about another 1,000 individuals. So again, we'll learn what that might do in terms of helping us, but again, a very affordable thing to try.
Thank you.
I was just going to mention, I think the key here is to really think about the challenges that you've experienced in the community and how having some additional resources can be applied to that, either to try some things that you maybe, hadn't had the resources to try, and maybe don't 100% know whether that will work in the community or not, but that now can test and see if that will work, and adapt or adopt that depending on on how effective it is. But I think the first thing is to really identify what challenges are existing. Are you recognizing that there are some gaps in providing the kinds of programming that people need in the community? Okay, well, can this help you develop the capacity to meet those needs? And particularly if you're able to partner with another organization locally to sort of not necessarily have the whole load be borne by your organization, but to be able to sort of share both the resources and the work that comes along with it. So I think that's really key. I can say, and Barb can speak to this a little bit, certainly like having challenges with getting the virtual Healthy Living with Diabetes program going in Brown County is probably a precipitator to Barb trying some of these new outreach methods and partners to be able to boost the numbers of people and the interest in that program. I don't know, Barb, if you want to say a word about that.
Sure. We tried a number of different times, a number of different strategies and marketing techniques to try to boost the interest in the virtual offering of Healthy Living with Diabetes. And we just could not put our finger on, with a number of different partners, why not the interest in virtual versus what we had experienced with in-person prior to the shutdown. So, some of it was just being honest with our partners and saying, something's not working here. What are you experiencing within your health systems with virtual, and just having those conversations back and forth. And to the degree that we were pretty upfront saying, we may not be able to continue this program if we don't find that another nugget that's going to work, and everybody weighing in saying, no, don't discontinue it. Let's figure this out. So I can only say that at some point, it's not just sugarcoating everything, but just being honest with our partners and where we're at, and how an honest conversation of, do they value this in the community or don't they? And that's kind of where we got to those next stages of, working together.
Oh, did it go all right?
Yes. I'm gonna mute here for a second. Okay. Just to add to that, and what Chris and Barb are alluding to too, is that taking we're really encouraging you to take a hard look at what you can realistically do also. What are the issues, and then what can you realistically do, and what partnerships are available for you to leverage. We're seeing a lot here just at the state level. We're seeing a lot of folks, and it could be COVID related, we don't know, where folks aren't doing the programs that they originally had people trained to do. So is it an issue of capacity? Is it an issue of lost leaders due to COVID and or other circumstances? It could be a variety of things, and it probably is a variety of things. I know I've spoken with some of you about that. So taking a look at what your capacity is, and do you need to train more leaders to replace lost leaders? And maybe that's, I know I was talking with Deb in Eau Claire County, and that's what she was saying is during this last year, she's lost a lot of leaders. And mainly because of COVID, maybe it has exacerbated some of that or sped that process up. But it's, the typical people move on from different jobs and things like that. So, but I guess my encouragement to you all is to take a hard look at what the capacity is, and replacing leaders is great. And that's one way that we can utilize these extra funds. But do you want to replace leaders for programs that you may or may not be able to implement? So taking a hard look at your menu of options and figuring out what can you invest your resources in. And like Barb was saying, talking with your partners as to what are the needs and the focus areas in your communities, and really pouring your efforts and your resources into meeting those gap areas. So those are kind of the themes that we're seeing is participant recruitment, for those programs that do meet those gap areas and the interest in the community and the partnerships are there. Then we have, so participant recruitment is one, and awareness building of these programs. Then we have the new programs. So maybe it is bringing on a new program and you have partners to be able to help do that, or you have capacity yourself to do that. That's definitely a common theme as well. And then just replacing what has been lost. So those are kind of what we're seeing right now, just to kind of recap what people are thinking. And I think it flows with the conversation that's happening today as well. So any other ideas or additional comments to those topics?
Yeah, I think it would be great to hear from people as to what they have experienced. What is their perception? Have they, indeed lost capacity due to lost leaders? And you can put this in the chat, or you can email this to us later. I think just sort of being able to take the temperature of the provider community here and understand, what the sort of net effect of having gone through the pandemic, and maybe it's not just the pandemic, it's just, sort of the cycles of program providing. But, just so we can have a better understanding of what your capacity exists at today, what you see, as you look to the future is the kind of programming that you want to be able to offer. And I know we've talked a lot about partnership development, and I know Jill is interested and happy to help people if they're having some challenges with developing partnerships in their local communities or counties. So I think, that's the key is really, sort of taking, as Barb said, sort of a hard, honest look at your situation and where things stand currently. And reaching out and talking about it and trying to find ways to, again, with this sort of short-term funding, it could be the thing that can provide you with the kind of resources or help you develop the partnerships or build your capacity to be able to do things more long-term once you get people trained and get programs up and running.
Without the pressure to do more. I think that's it. Sometimes, we have more money, let's do more programs, which is awesome. We would love to see that, but are you going to be meeting the needs of your community? Are you going to be able to be providing the programs that you want to provide within that growth? So
wow, I'm just looking at the chat here. Laura Armstrong said her department was cut in half and positions eliminated due to the pandemic, all which were program leaders. Barb says we have no trained leaders. I'm scrambling to put together recruitment materials. And Barb, reach out to us on that. Are you meaning recruitment materials for leaders? To get new leaders, we have a couple of things that we might be able to help you with. So reach out to us with that. Kate said their champion doctor retired and a champion diabetes educator took a new job, and we had a health system sell a facility and disrupt referrals. So you had a triple whammy there, Kate. And I think, you know, some of this is pandemic related and some of this is just like what happens sort of regularly. Things are kind of constantly changing. So yeah, there's a lot of strikes there that make it, I'm sure, very, very challenging for that. But, you know, again, I think the key message or the broad message here is reach out to us to try to help you in the ways that we can to if this funding is available. Now, Laura obviously is in a health system. So, but is there a way for her health system to partner locally with the ADRC or aging office there and potentially be able to work out some sort of a deal? And I know they do now already, but there might be some opportunities. Anna says they've lost many trained leaders as well, both from their agency and partnering agencies. Tough, yes, but this can help you have some more people retrained. So if you've already have the program embedded, can you beef up your leader core there with some of this funding through the aging units?
Yeah, and using this opportunity, like we said, to take a step back and figure out where your priority areas are, what your partnership interest is, things like that. It's a great opportunity to do that. And Erica says too, if you could share examples of MOUs. Yep, and I think Angie, you said you had some examples of those that you can share. So that sounds really good. The other thing I can tell you that we're working on at WIHA is looking at volunteer recruitment and retention. We're just in the initial formulation stages, but we know that that's a need. So it's developing, whether it's developing recruitment for leader materials, kind of a kit for volunteer recruitment and retention. So reach out to us and let us know what those specific needs are, what would be helpful, because like I said, we exist here to support you. So whatever things that we can work on and start developing that will assist your efforts is great. So the more we can hear from you, the better.
Mm-hmm.
Okay, good. Jamie says be helpful.
And it looks like in Trempealeau, one of their leaders is retiring from the Trempealeau County Health Department, is going to help finish out the things that were postponed, but they're seeing retirement as well.
Okay.
And let's
Leader
see.
recruitment materials. No, it looks like Anna too says leader recruitment materials would be great. So we will keep working on that for sure. And maybe reach out to a couple of you to look and see what we're developing if that's on target or not.
Mm-hmm. And Michelle is asking about using the dollars to purchase hotspots and tablets. To have a library of these, they can check out. How many would you recommend purchasing for a class? 6, 8?
I mean, ideally, we want our classes to be about 10. So yeah, I would say 10 would be great. 8.
I'll just add a little bit what I've heard from other AAAs or area agencies on aging across the country. They have been getting about 5 or 6 tablets and keeping those because not everyone in a class or a workshop will need it, maybe 1 or 2. And then creating, there needs to be policies created around, if you're using 3D dollars, around who's going to maintain that. Are you going to be collecting it at the end? And most have it set up with their IT department that is the only thing they can access is the link to the workshop. And then they haven't had a problem getting those returned. I think if you're loaning them out and they can have access to the internet and do all kinds of other things on it, you may have a more difficult time retrieving those. So I can help put you in connection with different resources to help you create that lending library if you're interested. But if the funds are going towards using those for evidence-based programs, yes, you can purchase tablets, hotspots, whatever needs to be to accomplish the class.
Okay, thank you, Angie. All right. If anybody else wants to add anything, let's do that now. Otherwise, we will go ahead and move on to program updates. It's good to hear all of this feedback, and thank you for the discussion in the chat as well. It's really, really helpful to hear what challenges people are encountering and the ideas, the great ideas as far as how to move forward. Okay, it looks like Barb has some example iPad loan policies, so that's great. Thank you for sharing. It's the beauty of this group, so we can all share and learn from each other. All right. Chris, should I move on to program updates?
Yep, please do.
Okay. All right. So very related, but kind of shifting gears is what are some program updates that are happening at the WIHA level that we will be assisting you with over the next second half of the year and then into 2022. So I'll go over some general ones and then open it up to Shannon and Aaron to add anything more on their respective programs. But in general, we want to talk a little bit about leader trainings. So as you know, in 2021, everything has been in flux. As far as our leader training schedule went, we originally did a first half of the year schedule in the beginning of 2021. And the second half, we are just playing everything by ear. We didn't know how the virtual leader trainings were going to be received. We didn't know how any of that was going to happen. So we're just basically right now adding a couple trainings here and there as needs arise for 2021. But with that, and in general, what we are asking and requesting of all of our partners is if you are interested in having someone sign up for a leader training, it would be awesome and ideal if you could have those folks sign up at least 1 month in advance. Because of these virtual leader trainings, we've had to shift our processes a little bit, and we do need some additional time to have materials be mailed to trainees, to be able to even determine if we're canceling or not. We need to determine that a lot sooner than we used to determine it because of those materials being mailed to trainees. So it would be also, we know we have the addition of our basic training that we've incorporated into some of our programs where folks will need some time to take that basic training before the actual leader training starts. So those are all kind of reasons why we're just requesting from all of you, all of our program providers and partners, to try to have your folks sign up. Like I said, at least 1 month in advance would be super helpful for us to make sure that we're utilizing our resources best and everything can run smoothly from there. So thank you in advance for doing that. And that is going to, go into 2022 and beyond also, because as we've talked about before, we know that we're going to be offering both in-person leader trainings and virtual leader trainings going forward. We know that there's benefits to both of those. And in our world today, that's one blessing that's come out of this, is the ability to do both virtual and in-person now. So we are going to be planning our 2022 schedule this summer. So we hope to get that out early fall to you all, or sometime in the fall before November. Our goal used to be to get it out by the end of the year, but we really want to get those out. We know that you're setting budgets and getting stuff planned right now. So, early fall is our target to be able to get to you a whole 2022 schedule for the whole year. So in 2022, we're hoping it looks a little bit more solid than it did in 2021. So that is our plan. As always, let us know if you're seeing needs as far as programming goes. If you have strong desire to get people trained in a certain program and you don't see that on our list, please let us know so that we know where that demand is and we can add things accordingly. A couple other program updates I can tell you from the chronic disease self-management program side of things. Many of you have hopefully gotten emails from me, but know that there is going to be a new Healthy Living with Diabetes manual coming out, not a new curriculum, and it won't be any update trainings or anything like that, but just a new manual with some minor changes in it. So expect that to happen at some point this fall. We will mail those to you when that happens. So just stay tuned for program updates and things like that with the emails. You're still going to be using the same books and things like that. So not anything to be alarmed about, just know that that's coming. And then also for Healthy Living with Chronic Pain, we know that there is a actual curriculum update coming. I think I've mentioned that in previous office hours. So that one will be an update training for any active Healthy Living with Chronic Pain leader. We were told that it was going to happen this summer. However, we have not gotten any additional information on that yet from the national program authors. So we're now estimating to do those program update trainings late in the year, like November, December, maybe into January. So if you're Healthy Living with Chronic Pain program provider and you have questions about how many books to order and things like that, my recommendation to you is to just plan for this year and not purchase anything or plan for anything for next year at this time yet, until we get those new manuals, new books, and all that good stuff. So that is my program update. Erin or Shannon, do you want to add anything with the other programs?
Erin, if I could jump in first, because I got to head off here. But yeah, just a few updates about stepping on, and Mind Over Matter is stepping on. Just a reminder that the recertifications are kind of done and over with. And so those that were not recertified will have to attend a full leader training to be basically recertified to deliver the program. We're looking to only keep the two upcoming stepping on leader trainings. One is virtual and the other one is located in Rhinelander at the beginning or the first half of September. Just because with the new program updates coming up, we want to make sure that those are getting trained, have the ability to utilize the current program as it is in a workshop before the new program updates come out. The new program updates are still on track for release in the first quarter of 2022. So we are finalizing our discussion, yay, with the program providers in about another week here. And so Abby Whitemarsh and I are working on getting and cleaning up the manual, so it's a quick turnaround. So we keep that timeline on track. So we're getting excited about it. And I hope that all of you that are trained in stepping on really appreciate the changes and know that your voices were heard and implemented within the program changes. So I know I've kind of leaked some of those over the time to help you understand that the good things are coming in time. And so patience is very appreciated. But for 2022, yes, we will be engaging in some refreshers, just kind of like the self-management program updates. Is there will be a small fee associated with it because of a new program manual that will be distributed, as well as some time that goes into delivering those refreshers. And again, this will be a nationwide effort. So those leaders will be engaged with other leaders across the nation at some point too. And then Mind Over Matter. So that one is also on, nothing has changed. That one is still available to be delivered both virtually and in person. Both programs, I just want to share that if you have leaders attending a virtual leader training virtually, then those leaders will be available to co-lead or co-lead stepping on and lead Mind Over Matter virtually and in person. If a facilitator is attending an in-person training for stepping on and Mind Over Matter, they will only be available to deliver the program in person. Please know that both of those programs will have a cross training available in 2022 as well. So then that way, if those leaders that are only wanting to do in-person change their mind down the road, they will have the ability to upskill themselves and deliver the program virtually as well, if that's something that they want to move towards. So we just want to make sure that the whole spread of availability to leaders in those two programs is there, and but at the same time we respect where they're comfortable at too. So thank you.
Great. And then I just have a couple of updates for a couple of other programs. So PALS, our physical activity for lifelong success program. I am doing recertifications with leaders who have been trained. So if they'd like to continue with that program, they do need to be retrained no later than October. We did have a leader training this fall, but that was canceled due to low enrollment. So we'll hopefully have 2 trainings coming up in 2022. I just also want to note that if anybody is interested in this program, which is a physical activity program targeted for sedentary older adults, which might be a great option after we're all coming out of COVID. This program does have equipment that is a little bit more expensive than some other programs. So it might be a great option or time to get started with this program with the extra Title III-D funding. So if you're interested or have any questions about the PALS program, please reach out and I can walk you through any of that. Our Stand Up and Move More program has 2 leader trainings this fall. Both are full. If you're interested in that program at all, please reach out to me and I can put you on a list for the first to be trained in the spring. Just a reminder, that program leaders will be trained to deliver it virtually, telephonically, and in person. We did just schedule a leader training for our Powerful Tools for Caregivers program this fall. So if you're looking to have anyone trained in that program, those dates are up on our website and registration is open for that. And then lastly, our Walk with Ease program, another physical activity program. Just keep in mind that one's super easy to get leaders trained, and you can also use Title III-D funds for that one to purchase the books, and participants can do that one on their own. So you could have a leader trained and they could do it that program in person, but it's not necessary to have a leader if you're just encouraging participants who can just take the guidebook and then they can just do the walking program on their own. So that might be a good option or opportunity as well. Any questions about any of those programs, please reach out to me and I can help. Thank you.
Thanks, Erin. Thanks, Shannon.
I see Kate said she just had a full Walk with These class and it was a blast. That's great to hear, Kate. Thanks for keep those uplifting messages coming our way. It's great to hear when there's a full class.
Awesome. Thanks, everyone. Back to you, Chris.
Okay. In the last couple of minutes, I'm just going to talk a little bit about the new sort of movement in Wisconsin, and probably many of you have heard something about this, but we're all really working to keep this top of mind. It's the Wisconsin Coalition to End Social Isolation and Loneliness. And it's really comprised of a steering committee at the moment and some work groups that are really working together to try to come up with strategies to help support people who are lonely and isolated in local communities. As you can imagine, this is not a new issue. You know, people have been lonely and isolated, for a long time. And I think we've all recognized this and understood it to be, sort of a problem, but a problem that may not have had some sort of evidence-based type solutions. And that's still sort of the case. We're still looking for the kinds of interventions that are evidence-based that we know can support people who are lonely and isolated in their communities. So, so this is why we've created this coalition, and there are opportunities now for people who are interested in playing a role as part of the group. We have 4 different work groups that are working on this. We're kind of using a collective impact approach. So we're working to develop kind of a common agenda. So we're all working kind of towards the same goal, a shared measurement system. So we'll know when we've sort of reached some sort of metric that is moving the needle when it comes to people who are lonely and socially isolated. And then we're going to create some mutually kind of reinforcing activities so that, the kind of work we're doing has some sort of common, common goals and metrics, but that we're doing it and deploying it across the state versus just in local pockets. There'll be kind of continuous communication going on throughout this coalition. So there'll be regular sort of updates, and folks who are interested in becoming part of work groups will kind of know what's going on. And then lastly, we'll be looking to, and right now DHS is sort of providing the role of a backbone organization that can kind of keep all the work going. Unless you have like an organizing group, it can be challenging to keep a coalition moving forward. It's been a very dynamic thing to be part of. Myself, I'm part of the public awareness work group. I know Shannon Myers is also part of the research group. I know Angie is part of, Angie Sullivan here is part of the detection and access to resources group. So there are lots of people who are really people in organizations that are really putting their time and resources behind this to try to find solutions to this. It's one thing, again, to think of it as a problem that's, sort of sad and, things, recognizable. It's another thing to recognize it as a public health issue. And that's what it has become, is a public health issue for people. It has significant impacts on morbidity and mortality. There's higher cardiovascular risk for people who are lonely, more depressive systems, more cognitive decline, and social isolation increases health risks similar to obesity, physical activity decreases or declines, air pollution, and smoking. So the health impacts are there. So it's important that people consider becoming part of the coalition. There are a variety of different ways that you can participate. And I've put in the chat a link to a survey that can help you both talk a little bit about your interests, but also indicate what you'd be interested in working on. We have these 4 work groups, one around research and shared measurements. So we're really looking at what's evidence-based out there, and how do we develop the metrics that'll tell us whether or not we're reaching people in the community and we're making improvements. There's an advocacy and public policy work group. So looking at systems changes and ways we can impact policy that might come to bear on people who are lonely and isolated. There's a detection and access to resources group. So that is, how do we identify people who are lonely? It's easy to see if someone's socially isolated because they're, alone in their community, but loneliness is a feeling. It's not necessarily something that you can see from the outside. So how do we detect that, and how do we provide the access to the resources that people need that can help them change that for themselves? And then lastly, raising public awareness. We already have some work happening in that area around the creation of resources to not make people just recognize themselves as lonely, but how do we get them to find meaningfulness, purposefulness, the kind of connections that can change how they feel about being socially isolated or being alone, and make connections that become social connections that make them feel differently about that. So I know this is a sort of short little overview. If anybody's interested, you can reach out to me, but I recommend that you do take this survey if you haven't already. For those of you who have done the survey, the work groups will be reaching out to those folks and inviting them into some more organizing meetings so that we can kind of get people up to speed on what's been done to date, and find places for people to provide feedback, people to be part of the work as we roll it out into communities. We know we need lots of people on the ground because this is a community issue, and we're only going to solve it by helping people within those communities connect to one another. I'm just quickly looking at the chat. Angie says the detection access work group is looking for representation from healthcare. So if anyone on this call is interested, please feel free to reach out to Angie. And I think that's the last of the comments around this issue. But it is 10 o'clock. I don't want to keep you 1 second longer. Thank you all so much for joining us on this call. We hope this is important and good information for you, but honestly, just seeing you all here is so great for us. We'll talk about this for a while afterwards. We really appreciate you're spending some time with us, and we're really looking forward to working with you into the future. So thanks again for joining us, everybody. Feel free to reach out. And with that, I will say goodbye.
Thanks, everyone. Bye.
Thanks, everyone.